Hi doctor friends, welcome to my YouTube channel PG Doctors INDRANJU. It is very important topic for NEET PG, AIIMS PG, PGI, FMGE and all types of medical PG examination. So let us start, and I want to say that please subscribe my channel if you like my video, and write in my comments box. Start with anti-hyperglycemic drug. What is anti-hyperglycemic drug? Anti-hyperglycemic drug, that means which reduce the blood glucose level or decrease the production of the glucose intestinal or in the liver glucose formation, and increase utilization of the glucose in the body. Start with the anti-hyperglycemic drug. It is two types: parenteral drug and oral. Parenteral drug is divided into three groups. First, itself insulin. Next one is the amylin analog. It is the synthetic analog of isolate cell of the pancreas. That means amylin analog. It includes pramlintide. Especially it is acts on type 1 diabetes mellitus and type 2 diabetes mellitus in both cases. Next group is GLP analog, also known as glucose-like peptide. Glucose-like peptide analog, it includes exenatide, liraglutide, albiglutide and dulaglutide. Here you have to remember tide. Next one is oral. Oral glucose reducing agent is which release insulin. That means insulin secretion enhancer known as secretagogue. It is of following types. It is of first miglinide. Miglinide includes rapaglinide, natiglinide. It is both are for the postprandial hyperglycemia. Next one is the sulfonylurea. Sulfonylurea, it is of first generation and second generation. First generation includes chlorpropamide, tolbutamide. Chlorpropamide is the longest acting with maximum effect. Tolbutamide is the shortest acting. If the remember in that, the tolbutamide is written like tol and you may pronunciate it like tall. So tall, that means longest, long. But you have to remember opposite, that means short. So it is shortest acting. Next is second generation. Second generation, it includes glipizide, gliclazide, glibenclamide, glyburide. In this, it is weight Side effect of the second generation sulfonylurea have weight gaining side effect, but it is less in case of glipizide and glycolazide. Next one is first first is which release insulin, that means secretagogue, the mechanism of action of the oral glucose of the type which release insulin, that means secretagogue, and other anti-hyperglycemic drug which reduce the glucose production and increase utilization. It is second type is by other mechanism. It includes biguanides, thiazolidinediones, alpha glucosidase inhibitor, D2 agonist, DPP4 inhibitor, and SGLT2 inhibitor. In the biguanides, this has property to decrease glucose production, increase utilization, and decrease intestinal glucose absorption. It includes metformin, fenformin. Metformin is the drug of choice for type 2 diabetes mellitus. In thiazolidinedione, it includes pioglitazone, rosiglitazone. Next one is the alpha glucosidase inhibitor. It includes acarbose, miglytol. Next one is the D2 agonist, which includes bromocriptine. Bromocriptine has many properties. I will upload about bromocriptine. Next one is the DPP4 inhibitor. It includes sitagliptin, vildagliptin, saxagliptin. Next is SGLT2 inhibitor, which includes dapagliflozin, canagliflozin. This is about the classification of anti-hyperglycemic drug. In next video, I will upload the all things and drugs used, side effect of anti-hyperglycemic drug. So it is most important topic for second year MBBS and also for the PG preparing student. So write in my comments box for this video. Thanks for watching my video. Have a nice day.